All right, Mr. Nambiar, if you could tell us about the current projects of your organization.
Thank you for having me here. It's a wonderful opportunity to share and learn about healthcare and what progress healthcare has made in India. We as an organization started looking at healthcare 3 years back, very focused manner. EMC globally is into healthcare in a big way, but out here in India we felt that as a technology company we could make a difference in healthcare. Healthcare itself is poised for innovations. Today healthcare in India is still largely paper based, siloed out systems where you don't have end-to-end integration between the customer, the service provider, the labs. All those pieces don't come together, right? So it's a long cycle in terms of service delivery, and because of that, whether it is public healthcare, which is delivered through the government, or the secondary tertiary care that you and I get from large private hospitals, there are lots of places that things have to improve, right? And we have looked at both those spaces. We see lots of areas where technology can come in and bring synergies, get greater optimization, lower costs, and equity in service delivery, right? So the fact being that somebody sitting in Delhi has much better access to healthcare versus somebody who is just a few hours away from Delhi, right? Not to go that much far. So how can we bridge that, right? And those are the spaces we are looking for. One is that. The second is, once you have all this data together, what next can you do, right? What is the better things that you can do? Because the idea is to not look at curative, which is mostly what we do today. You fall ill, you go and take a medication, to preventive and wellness, right? How do you go towards that at a nation scale, not an individual scale? I mean, today individuals are doing it, but as a nation, can we start towards that as a focus? So that's where we feel that as a technology company with strong technology background, we are the largest storage providers in the world, right? We also do lots of analytics. We are cloud providers. So, and we have our analytics divisions, and we have expertise of having done this in various verticals, right? So how can we use those to bring value to this particular ecosystem, this particular economy? And we are also looking at not only this economy, but all such economies, right? How can we become valuable to all such economies, all emerging markets, so to say.
All right. Well, accessibility and affordability is the major challenge of healthcare sector, specifically for the marginalized communities. So how do you think data and analytics would be able to help this particular sector? And as you also spoke, going ahead and bridging the gap, rural versus urban. Yes. So how would that be taken care?
So two things are there. I think when we look at healthcare globally, there is a lot of what we call a social mobile enablement of healthcare. That I think we are still a bit away in terms of our infrastructure capabilities to sort of do a telemedicine for remote care. So we need to sort of wait on those aspects, because I think those have been tried and not been successful because they were ahead of their curve. But infrastructure is improving as we see a lot of effort from the government to actually connect those villages. The last mile connectivity is a challenge. Those will improve over a period of time, right? So we should make those starting efforts today. We cannot wait till infrastructure is there. So one of the aspects, one of our projects is actually trying to take healthcare into rural India and enable the service delivery folks, the people who actually do last mile service delivery, the ASHAs, the ANMs, the health workers, to now come on a digital bandwagon. Right? Today they do a lot of service delivery, they collect a lot of data, right? And all the data collection happens on paper, right? Because of two things happen. I mean, these are sort of not highly educated individuals, right? So they are doing data collection, so there is always error that creeps in these processes. Then also the delay. So if I collect some data on the ground and I have to put it on paper and send it to a district, right? There is a delay that creeps in. So because of the delay, disease outbreaks are not caught on time and spreads are not caught on time, and also awareness and education that you need to give to the people who then communicate to the community at large. That's not happening, right? So what we are doing is, can we replace the paper notebook with a physical notebook, a tablet, right? So that's one of the projects that we are doing, and it's rolling on the ground. And what we see is that it will bring in a paradigm shift in the way healthcare is delivered in India, especially for the marginalized, as you said, the marginalized, the rural, people who don't have access to these services. So that's the first step, right? Getting people onto that. And once that is there, because there is also a mindset shift. Today, it's all done, oh, we have to do it kind of a model. Tomorrow it will be done because we gain benefits out of it. So the health worker gets benefit, as in he does or she does not have to do this lots of drudgery once she goes home, and also gets to see the effect of the care she is giving. She can see how a pregnant mother whom she is tracking, how she is doing in real time, right, on the tablet. She also gets alerts and reminders on, oh, there is a checkup pending, so I need to take this lady to the health center. Now the doctor at the health center or the district medical officer can also get a feel of how service is being delivered on the ground, where are the shortcomings, how different areas are doing. Because today they are all waiting for this data to come back once a month and do the analysis, right? They don't really see how things are going around. Plus, when everything is on paper, we really cannot compare, right? So those are first steps we are taking. So we're bringing people up to a certain level, and once that level is there, then their expectations will go up, their interaction with systems will go up. Then we can go to the next higher levels, as in trying to now influence their behaviors. Today we are just getting them to sort of change their paradigm and do stuff on a digital bandwagon.
That is great. Dr. Nambiar, by 2028, our country would be the most populous country in the world. Do you think government's vision of Swasth Bharat to Sabka Vikaas and healthcare for all is really possible, or is this just a far-fetched dream?
I personally believe it is possible. It is possible when the administrative aspects of government has created that vision, right? The government has made the vision. Now it is for them to enable the rest of the ecosystem to come together. So you just cannot be a government-led activity. You need to have all the aspects. So you need people's participation on the ground up, which is the Swasth Bharat mission, where people are involved. But you also need corporates like us to step in, bring the best of technology, and large hospitals to come in and say, how can I increase my impact from, let's say, a big city like Delhi or Bangalore to the vicinity surrounding that place, right? Today, the reach of those hospitals is limited because they expect the people to come to them. How can the hospital reach out to people, right? So once that happens, whether it is a government hospital or it's, I mean, there are inefficiencies today. I don't disagree on those. But if we don't dream big, right, we will never achieve those. I think setting those targets is a good thing. Then now we need to have the right environment set up, policies, the right right partnerships, the awareness and education programs, whether it is also setting up universities because we have a large skill deficit in the country, whether it's on the ground in terms of service delivery, the professionals are doing the last mile service, or the very qualified specialists and doctors, right? We have lots of vacancies in positions even in today's ecosystem, right? We don't have doctors in the primary health centers. So we need to fill up those. So one piece is that even in the larger segment, as in the urban population, we need a lot more beds. We have a shortfall on beds, right? So those pieces will have to come together, but also a larger vision in terms of using technology, because brick and mortar solutions are not going to scale. The amount of money that we need to put in for reaching out to everyone and covering everybody is with the brick and mortar solution that we sort of tend to try out in the last several years. That is not going to scale. We need to now piggyback on technology to ensure that the reach is, everybody is covered and the costs come down, right?
Right. 70 billion is the current value of this particular sector. Do you think FDI's role has helped in it, FDI coming into picture in the healthcare sector, and up to what extent?
I think any kind of infusion of capital, right, is always good, because as I said, we have infrastructural challenges today. So getting people to come here and invest brings anyway a value add to the whole sector. It brings visibility.
This is in context specifically serving the rural.
Yes, absolutely. I am saying in the context of rural itself, right? That is where we want the private sector to come in, right? So the capital coming in also means that there is now a larger interest from a non-governmental players, right, who will now come in and make sure that the rural population, the marginalized ones, are now getting served. And in doing so, they will come up with new business models, right? Because if they are putting money, they have to monetize on top of it. But in doing so also, I think there will be multiple effects that will come into play. One is healthcare itself will improve, but the whole rural ecosystem, because there will be other jobs, other things will coming in. So I feel opening up is good, but we still need to be sort of playing around with our cultural identities. So government has a large role to play. Our people are not as savvy as some of the other countries, right? So we need still that guidance and control so that people are eventually benefited by these mechanisms. Right. So from that, an oversight from the government is good, but opening up the sector would mean that lots of inefficiencies in terms of service delivery that the government has, primarily that might go away, because more people are coming in and they would be on the ground trying to understand the challenges, putting their own people to strengthen that ecosystem. So having that partnerships are good.
Do you think corporate social responsibility in healthcare would also help?
Yeah.
And if there is any existing projects of your organization, if EMC is involved in CSR in healthcare?
Corporate social responsibility sort of targeting towards healthcare would definitely help. It will have to come from the corporates themselves. Mandating them to say you need to put 1% on healthcare usually ends up being an exercise in futility. So corporates have to see where their vision is, what their goals and principles are, and how it aligns to different verticals, right? Somebody might go green, somebody might look at environment, somebody might look at education, and somebody might look at healthcare, right? It is not just enough to put the money. You also, as I said again and again, there is a fundamental need for qualified professionals, which as part of CSR, you could probably tell your employees to actually fill in those gaps. In our project also, we have got people to actually go down on weekends and contribute some of their hours, volunteer, as part of a CSR initiative, right? The involvement of the employees, right, brings a connect to the project. Instead of just giving money, you need the people to be involved, because lots of the challenges today is people presence, right? You need to make sure, okay, if there is a school's immunization program, then somebody has to be there to make sure all the logistics is arranged properly. So that kind of activity will bring, one, the manpower on the ground. Second, it will bring sort of a realization of the condition on the ground to the larger population, the larger citizenry, right? So an urban population would also become aware of the challenges in rural. So as and when they get into larger roles, they will realize that there is something they can give back, right? So that connect with people is important. So I believe that it's a great opportunity in CSR, but the initiative has to come from the corporate with their principles, their guiding thoughts aligned with those activities.